as we take it upon ourselves to just kind of enjoy this day. And we are this morning talking about mental health, bringing in Labor Day. Of course, we celebrate the day to honor the hard work and the dedication of American workers, but it is also important to remember that our mental health deserves just as much attention as our productivity. And we want to have this important discussion with you right now. Lauren Howard, CEO of LB Health, joining us this morning. Lauren, thanks for joining us this morning on this Labor Day. Hopefully you're not working too hard.
Not too hard, no. Thanks. Thanks for having me.
Oh, of course. I want to talk about this important subject. We can't really discuss enough how important mental health is, right? Now, at LB Health, they've been advocating that this time is good to focus on mental health. Why is this connection between work and mental wellness so important?
Yeah, I think, as LB Health as a company, we actually started focused heavily on burnout, toxic work environments, and workplace trauma. And we realized that a lot of the people who were coming in for that support were coming in because they didn't truly understand what the real definition of productivity was. Their understanding was that productivity meant I have to be doing something all the time that is incredibly active, that shows outcomes, that proves to somebody that I am busy, 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 when in reality, productivity can mean a lot of things. And the thing that leads to burnout is this feeling like we can never rest, not the feeling like you're working too hard.
I mean, we do struggle. I mean, we struggle with this idea of being on. Like right now, I am on. This is part of my work flow is to be on. We're on air and we're on the stream here live. So what are some of the signs, though, that someone might be pushing too hard and neglecting their mental wellness?
Yeah, I think it's, we often see this thing we call the Sunday scaries, which means Sunday night before you go back to work on Monday morning, you're nervous, you're anxious, you dread it, you don't want to go back. That's a sign that maybe you're overdoing it, or maybe that work environment is not conducive to the rest and the time off that you need in order to get back to it at the full level. In general, you'll see a sense of apathy toward work. You'll see a lack of eagerness to do a job that maybe you really enjoyed before, and a desire to be anywhere but, which, sometimes people have jobs they don't love, and that's the reality of it, and everybody has to earn a living to pay the bills. But that doesn't necessarily mean that you have to suffer through something that it makes you really unhappy.
All right. So as people head back to work tomorrow, so today having those, what do you call them? The Sunday sillies?
Sunday scaries.
Sunday scaries. Not silly. I don't want to demean it. But what advice do you have for maintaining then mental wellness the day approaching, the week of, especially in these high pressure work environments?
I think there's this idea that we misunderstand what productivity is and what the outcomes of it need to be in order for them to be valuable. So I say this a lot, especially to people who use our services. We also work with a lot of neurodivergent people, autistic people, and people with ADHD who struggle with executive dysfunction, and they don't always understand what productivity really means because they think it means just be busy. Rest is an activity. Rest is productive time. And when you start integrating that into your idea of what your productive time needs to be spent doing, it changes your perspective on this idea of busy versus getting things done in the time that they need to be done. Rest gives your body time to restore. It gives your brain time to reset, your nervous system time to, process through everything that you've experienced recently. And it doesn't mean you're going to sleep. It can mean disconnecting. It can mean turning off the phone. It can mean doing something with your hands instead of active work with your brain all the time. That is productive time because it's vital to the operation of your body and your brain. And if you start integrating that into your perspective of what successful work and time are, it changes the perspective a whole lot.
I love rest. I prioritize rest. I love to turn it all off when I leave here, as much as I love my job. But talk to me about Lauren, LB Health. You said this is what you guys do. Virtual mental health resources. How does your operation work, and how do people get involved?
Yeah, so we're available in all 50 states. We have assessments for adult autism, adult ADHD, as well as full mental health treatment. We also have psychoeducational groups. So, sometimes people maybe don't have a diagnosis or aren't interested in getting a diagnosis, but would still like the support that maybe would come along with it. And we make that available as well. Everybody can sign up directly from our website. You can talk to a navigator on our website who can explain the care. Most of it is covered by insurance in most states. And we try to make it as accessible as possible, both through taking insurance as well as creating programs that are affordable to those who are uninsured in the most accessible way that we can, because creating a solution that provides great services but that people can't access doesn't help anybody.
Yeah, for sure. I mean, and technology hasn't been so great to be able to have that connection, especially for people who might not be able to physically take away a couple hours to drive to a therapist's office, but at least you'll be able to access that mental health support.
Yeah, absolutely. And we also work a lot with individuals who are in very rural areas who, short of literally driving hours to reach their nearest clinician and often waiting months, if not years, to get that care, wouldn't get access to that care at all. And so it really has opened up a whole lot of availability of very niche care. Neuroaffirming mental health care, especially with assessments for adults, is pretty hard to find. And it really has opened up a whole lot of availability to individuals who just assume they would never be able to access it.
And Lauren, talk to us about you don't have to be in a crisis to seek mental health help or support, right? Talk to us about the varying levels and examples, perhaps, of why people should seek maybe some support in a mental health capacity.
Yeah, I think that's a really big kind of misunderstanding of what mental health care is. Just in the same way that you don't have to have an active illness to go to your primary care, because preventative care is so important, you don't have to be in the middle of a full mental health crisis to go seek services. It happened to me personally several years ago now. I looked up one day and realized that the world just had no color in it. I didn't feel excited about anything. I love dogs, and somebody brought a puppy over, and I was like, it's okay. And that was, I looked around and went, wait a minute, I'm not myself right now. But I wasn't missing work. I wasn't missing deadlines. I was still spending time with my family. I just wasn't enjoying life in the way that I normally did. And this was before I owned my own clinic, but I'm saying this as a person who has an entire career and background in mental health care, knowing what to look for. And I still missed it because when it's you, it's different. And so eventually I talked to somebody and they were like, yeah, you don't have to be at the end of your rope to need support. And so that's why we have services available that are psychoeducational, meaning you can just go get support from clinicians and peers without enrolling in an entire mental health program. We obviously have mental health care as well. And then there are some people who know they need something, they don't know what it is. They think maybe there might be a diagnosis there. Sometimes it's neurodivergent, sometimes it's something else. And so that's what we have the assessments for. Do we support people who are struggling and truly in the middle of a crisis? As long as it's safe to do via telehealth, absolutely. But a lot of our patients are just trying to get through the day in what is a really, really hard time to exist. And life is lifing. It's okay, but they just want it to feel comfortable like it did before. And that's a really good time to seek help.
All right. I think it's a really good time to have this conversation on this Labor Day, where hopefully a lot of people are just taking it for themselves, reflecting and resting. That mental health, work-life balance, it is a challenge at times, for sure, Lauren.
Yeah, and I think we have to start changing our perspectives on how much time needs to be spent working and what work and productivity actually are. And if we start doing that, we can be a little kinder to ourselves on the days where maybe we don't achieve everything on the to-do list, but we found another way to restore our souls in a way that it needed.